This might sound like a silly question, but what are the risks of using guided surgery?
Great question to ask, because here's the problem. Most of it's done by a laboratory technician, not by a dentist or a prosthodontist. Probably 90-something% of the time it's done by the technician designing everything. Because here's the thing that you need to take back into consideration and understanding. That dentists are not taught how to place implants in dental school. Okay? They barely get exposure to it. I know this because I teach it at the University of Oklahoma and started the first postdoctorate implant program there. I'm a technician that has a very good working knowledge of everything, but still doesn't know the limitations of implants and the position of implants.
Because they're not a doctor.
Correct. But you still got to put the substructure underneath it all.
Is this why it's important to have like a team of multiple experts?
Absolutely. If you want to get the best, if you just want good, here's the issue. If you have someone who designs it like we just said, the normal way, you're going to have a lot of errors. So you're going to have to redo a lot of steps. It's not that you can't get to where you want to get to and get the final good results, because they do. It's just a matter of how many steps you want to take to get there. How many inaccuracies do you want to deal with, and how many appointments you want to deal with to get to the result you're looking for. General dentist success rate is about 85%, 83% to be exact. Where a oral surgeon or a periodontist, the success rate nationally is 95%. The general dentists know bare minimum about bone itself. They know a lot about a tooth, they don't know about bone, and they don't know that much about soft tissue. It's not that they weren't educated on it, they never used it. Where a surgeon is trained to do all that. They understand bone, how to close tissue, how to reconstruct soft tissue and bone. So placement of that is critical. Because a lot of times they're placed in a bad location, the bone shrinks, now the implant is out of the bone, and it gets infected. I see that all the time. It's the number one thing I see. There's probably a week or two go by where I don't see a case where it was done by a dentist.